Hello, my name is Dorothy McFadden. I'm one of the registered dietitians with the St. Luke's Bariatric program. Today we're going to be talking about weight loss surgery and exercise. The current recommendations are 150 minutes to 300 minutes per week to maintain your weight loss after you have surgery. It should be a combination of aerobic and strength training. Generally, we recommend a focus on aerobic training the first 3 months after surgery. After 3 months, you need to incorporate strength training. You also need to continuously increase the intensity or the type of your exercise. Because your body will get more and more efficient if you continue to do the same exercise. It's important for weight maintenance because when you build muscle, you increase your metabolism and burn more calories even at rest. And remember, muscle is more dense than fat, so it's important to take your measurements. A pound is a pound. A pound will always weigh the same. But when you have more muscle, it takes up less space than fat in that same pound. So for bariatric athletes, it's a new specialty area. It's something that is starting to really explode as far as more and more people becoming very physically active after having weight loss surgery. It's estimated about 6% of all weight loss surgery patients become very active. In 2009, the ASMBS estimates that 200,000 to 220,000 people had weight loss surgery. So approximately 6% of that would be 12,000 to 13,000 individuals who are highly active or athletes after weight loss surgery. You should always carry information on you that identifies that you've had weight loss surgery because there is a risk after the gastric bypass that your blood sugar can drop, and if you do lose consciousness, someone needs to know that you've had weight loss surgery. And as it's a new field, there still isn't really definite guidelines yet, but let's look at the rules that you need to follow anyway and how that relates to exercise. You need to consume 60 to 80 grams of protein per day. If you're very highly active, you'll probably need more than the 60 gram minimum that we tell patients after weight loss surgery. So we give you a range of 1.2 to 1.7 grams per kilogram or 1.5 to 0.8 grams per pound of your body weight per day. It's how many grams of protein you'll need. So for instance, if you have a 140-pound woman, that would be 65 to 108 grams of protein per day. Okay, your first year after surgery, adequate protein is needed to support tissue healing, to limit your lean body mass breakdown, and to repair muscle damage that can occur during exercise. Highly active weight loss surgery patients will need extra protein supplementation to meet these increased needs. Frequently, we have people who will replete themselves with a protein shake after exercise when your muscles are really primed to receive that protein. You need to limit your sugar intake to avoid dumping if you've had the gastric bypass and also to limit your calories. But you also need carbohydrate to keep your energy and to keep fueling your metabolism and for endurance. So you need 30 to 60 grams of carb per hour. So what you should do is consume sports drinks, 24 to 40 grams of carb, or 1 to 2 gels. The thing is, if you've had gastric bypass, this amount could give you dumping. So you need to experiment with different levels of repletion while you're training to see what you can tolerate. One way to do that is also to increase your carb intake prior to long, intense workouts so you replete your glycogen. Increase your healthy carb foods with things such as toast or potatoes for several days prior to your long, intensive workouts. You could even do something like sucking on jelly beans per hour of exercise, which is similar to doing a gel. Limiting your intake of carbohydrate does increase your risk of hypoglycemia or low blood sugar in bypass patients. And unfortunately, we've had some patients that had episodes of low blood sugar after intense exercise and weren't sure what was going on. So you need to make sure you have adequate carbohydrate storage, which is glycogen. It's the source of energy for short, intense bouts of exercise, such as sprinting. It prevents muscles from being broken down and used for energy. It is always used the first few minutes of any exercise. So a typical person has stores of these glycogen. It's 350 grams or 1,400 calories are stored in your muscle. 90 grams is in your liver, 360 calories. And there's a small amount that's stored in your muscle and also circulating in your blood. The larger the muscle mass, the greater potential for glycogen storage. The maximum glycogen storage that you can have would be 15 grams per kilogram of body weight. So basically, you are storing energy. You're storing your source of energy for your workouts. The 30-60 minute rule in exercise. Do not consume liquids 30 minutes prior, during, or 1 hour after food intake. You need to sip all your liquids. The position statement from the Academy of Nutrition and Dietetics recommends 450 to 675 milliliters or 16 to 24 ounces of fluid for every 1 pound of body weight loss during exercise. So you need to weigh yourself before and after exercise. This would require about 32 to 48 ounces of fluid in an hour, which is 3 to 6 times more than a bypass patient can tolerate. So try to incorporate more fluid-containing foods prior to your exercise, for several days prior to your exercise, such as yogurt and fruit in addition to your protein supplements. Continue to drink fluids throughout the day and within 1 hour of your exercise session. And just be aware, most people only voluntarily replace 2/3 of their fluid lost. So even if you're drinking to thirst, you're probably not repleting yourself totally. Choosing a sports drink. During exercise, insulin production is decreased, which also decreases the likelihood of late dumping with conservative carbohydrate intake. So less than or equal to 60 minutes of moderate exercise, take water only. Greater than 60 minutes, hydrate with water and sports drinks. Choose a drink with a small amount of sugar, 10 to 15 grams of carb for every 8 ounces, and try to train your body to tolerate the carbohydrate drinks during training. So continue to keep doing that during your training sessions to get your body used to having that level of carbohydrate. And again, inadequate hydration could lead to weakness and poor performance and cramping when you're in an athletic event. Practice high-volume drinking during training so that you can tolerate extra fluids during the event. If you exercise more than 4 hours, you should not use only water to hydrate as you lose your electrolytes, that's sodium and potassium. So you want to use a drink that contains 120 to 170 milligrams of sodium per 8 ounces. Small amounts of sodium will actually allow you to absorb your water faster. And there's also creative ways to increase your sodium and your fluid. You could do a vegetable or tomato juice or broth, and also pickles are a good source of sodium. Eating before exercise. You should eat a carbohydrate-rich snack or meal before exercise to replace your glycogen stores. You can also use a liquid meal replacement because that has both carbohydrate and protein. You should include protein and carbohydrate to reduce your post-exercise soreness. And pre-op meals should be low in fat and fiber. And 30 to 60 minutes before exercise, have something with carb in it, whether you do a sports drink or a piece of fruit. Practice with foods and see what works best for you. Some foods may give you GI upset, and you don't want to experience that while you're in an event. There was a research study done on a bypass patient who was also a marathoner, and she shared some of the things she did to fuel her marathon training. She got up extra early in the morning and ate 90 minutes prior to her morning run, and she had a cup of Greek yogurt, a half a banana, a slice of toast with peanut butter. So you see she had a combination of carbohydrate and protein. She gave her food enough time to digest, which is why she got up 90 minutes prior, and then she could start her training. You need to give your food enough time to digest before you go out for a run or a swim. So if you have a large meal, you should wait 3 to 4 hours. Small meal, 2 to 3. And if you're going to have something shortly before your exercise, 1 to 2 hours before, you're better off with a blended or liquid meal. Okay? Examples of pre-workout meals. So if you have something 3 to 4 hours before exercise, you can make a fruit and yogurt smoothie. Again, it combines protein and carbohydrate. Peanut butter and jelly sandwich, oatmeal with almonds, banana and skim milk, low-fat cottage cheese with fruit. You could do a lean hamburger with a side salad, turkey and cheese sandwich, low-fat tuna with fruit, or non-fat milk with cereal and a banana. Again, you have that combination of protein and carbohydrate. After your exercise, you really want to restore fluid and sodium and potassium lost in sweat. You also want to replace those glycogen stores so you can continue to train, and provide protein to aid in the repair and building of muscles. So you should have some type of recovery snack within 15 to 60 minutes after practice. Some ideas for recovery foods: a smoothie made with yogurt or protein powder plus frozen fruit, a sports drink or sports bar, low-fat chocolate milk, that would be something that a sleeve patient could tolerate, crackers with peanut butter and banana, whole wheat pita with turkey and veggies with pretzels and low-fat milk. Again, you're getting in those extra carbs. And stir fry with lean steak, veggies plus brown rice. And again, you want to separate your liquids and your solids. That concludes my presentation on nutrition and exercise after weight loss surgery. There's a list here of references that you can utilize to get more information concerning how you should properly eat to train your best for exercise. Thank you.